Everybody, again, reminder, my name is John Wutai. I'm the Emergency Care Manager here at the Safety Council, and I'll be spending the second half of this presentation with you. So picking up where Dawn left off on inviting our staff back into work, staff members resuming work, what workplace policies do we need to review, right, as they pertain to COVID-19? Dawn mentioned the engineering controls and the administrative controls that go along with our mitigating the COVID-19 virus. And we're going to have a lot of administrative policies. What policies are we going to put in place that are going to help us mitigate the COVID-19 virus? What behavioral changes do we need to put in place with our staff that we need to reinforce with them probably a couple different times to make sure that those changes get met? Do we change or update our emergency operations plan? Remember that the assessment that you're going to do, to use that North Dakota Department of Health evaluation tool, that becomes part of your pandemic plan for your emergency operations plan. So again, what are these changes? Any of them that are put in place, we got to make sure that that's getting communicated to our staff as they come back in. And a lot of times that might take several communications. Briefly on respirators and masks, because there is a difference. So first off, what is a mask? So when we talk about a mask, we talk about a simple mask, whether that's the pictures that you see on your screen, that mask on the right. That's what I refer to as a procedure mask or a simple surgical mask. For those of you who might have had surgery in the past, you saw the staff down in that surgery area wearing that procedure mask. The picture on the left, again, that's a simple mask, a homemade mask like many of us are wearing when we're out in public. Both of those masks accomplish the same thing. They protect those water droplets, or at least the bulk of them, from getting out of us and interacting with other people. So if we cough or sneeze, it keeps that airborne factor down to a minimum. Now let's look at a respirator. When I talk about a respirator, that's going to be your N95 respirator. A lot of people refer to an N95 as a mask, but technically that N95 is a respirator because that mask filters the air that you're breathing in. Okay? Who needs to wear what? The only people that need to be wearing an N95 respirator are those individuals that are at high risk for contracting the COVID-19 virus. Healthcare providers that work with infected persons, public safety, police, fire, and EMS that may be responding to locations where there is an infected person. These people are at a significantly higher risk than those of us that are out in the general public. Okay? They need to have that N95 protection. If you have questions on these, right, specifically we're going to look at, you have an employee that chooses to wear an N95 respirator in the workplace on their own will. They bring in an N95 respirator and they want to wear that in the workplace. Once we get into the respirator side of things from an OSHA perspective, a couple different things happen. If you're going to require your staff to wear an N95 respirator, you need to have a respiratory protection program. N95 respirators need to be fit tested. They're sized. They use a fit testing procedure to make sure that they're adequately sealing to the face and accomplishing what they're designed to do. But when you get to the voluntary side and you get into Appendix D of the respiratory protection program, that states that if that employee is going to voluntarily wear that N95 mask into the workplace, you as the employer recognize that there is a certain amount of risk by an employee just putting on that mask. Employees that are going to wear a respirator need to be medically cleared. They need to be evaluated by a staff person that's qualified or a physician. to determine that they don't have any existing health risks that might exclude them from wearing that respirator. The common question is, where does that cost of that evaluation and fit testing fall onto? That's going to fall back onto you, the employer, unfortunately. So that's just briefly on masks. If you have more specific questions on that, I think we're going to have an OSHA representative here for the question answer session at the end that I think it'll be John Young, and he'll be able to field a lot of those questions for you. So screening employees, one of the tools that people are using and is recommended is temperature checks. Any person that enters your facility, if this is your staff coming into the building in the morning, it is a good idea to check their temperature to see if they're showing that is a symptom of the COVID-19 virus. The concept here is we want to protect our critical infrastructure. A lot of times we hear about critical infrastructure being our power plants, our water plants, and places like that our society needs. But think about your business. Your place of business is truly your critical infrastructure. And can we afford to let our building get infected? As your staff come back to work, our goal is to mitigate somebody sick and infected coming into our building and walking around and infecting that. And then now we have to close our business to disinfect. We have to find a company that's qualified to do that disinfecting. And how long is it going to take them to get around to disinfecting our building? How busy is that company disinfecting other buildings? It may not be a real quick process. So again, protecting our business asset becomes vital. The goal with the temperature checks is to start screening people as they come into our property. So Don mentioned earlier, the federal EEOC has approved temperature checks, and it's not going to be an ADA violation to exclude somebody from your property because of an illness or condition that they have. As you set this process up for doing temperature checks, make sure that you have somebody from your management or your leadership team involved. And not that it's that complicated, but we need to think about this as an operational flow as people come into our building and what that looks like. PPE. Are you going to provide personal protective equipment to your staff person or your people that are going to be doing these assessments as people come into your front door? They are going to be at a little bit of higher risk. You need to determine that number. And again, it's a good faith effort to protect that employee. Is a mask sufficient, or do we need to step things up to an N95 respirator? I'll try to help clarify that, where if you've got a person working at a service desk, for example, say in the trucking industry, where they are interacting with truck drivers that are arriving from all over the country, you can quickly see that there's a higher level of risk for infection as you deal with more people that have been on the road interacting with other people. Just look at things from that standpoint. How many people do you anticipate that person interacting with on a daily basis? And that will help you make that determination. Time spent testing your employees is compensable, meaning that if you are in a manufacturing environment and you have a shift change and you're all of a sudden you're going to have 50 or 100 new employees coming into your building that need to be screened, we need to plan ahead. They may need to arrive for work a little bit earlier and understand that that's compensable time that you're going to have to pay those employees as they wait to have their temperature checked. The threshold temperature is 100.4 degrees. That would exclude them from coming onto your property. Temperature checks, and should we record them? This is important. Understand that if you're having visitors or staff come into your property and you're handing them a piece of paper that goes through that general health assessment, have you been feeling well? Have you traveled to these locations? And maybe they sign that piece of paper. The thought would be, well, let's take that temperature and write that on that piece of paper. The downside to doing that is now we have created a medical record documenting part of the assessment performed on this person, and that's going to have HIPAA implications as well as privacy implications. So the best routine is to take that person's temperature, then maybe turn around and show them the temperature that was taken, and the answer might be, sorry, we can't let you come into the building today. So be very careful what you document. Any customer showing a fever should not be allowed into your facility. Again, this is about protecting your assets. Employees should be sent home, then follow the stay-at-home guidelines put in place by either their family physician, if they're going to go see the doctor for their symptoms, follow the guidance of that physician, or again, the North Dakota Department of Health, if they get tested and whom they ever come in contact with. So again, one of the questions is, have they been taking a fever reducer such as ibuprofen or Tylenol? And now that enters the equation as well, that they may have a fever. So we need to, on that assessment sheet, are you taking any anti-inflammatory medications that might prevent that fever from being present when we take their temperature? So keeping your employees informed, posting information regarding any procedural changes for all of your employees to see, whether you're posting that on your bulletin board at work in the break room, or your comment if you've got a first aid or health area that you post information on, having that out there. You can post it in a physical sense, or you can send it out electronically through emails, but we need to make sure that they're aware of any policy or procedure changes that they need to be aware of before they enter our property. Okay. Again, if we're bringing employees back in stages, make sure that everybody's on the same page and we're doing our due diligence to make sure everybody's up to speed. So access control to our facilities. Consider preventing all third-party visitors from entering buildings unless providing an essential service. Do your service people, does the UPS staff that do our package pickups and delivery, is it essential that they come onto our property? Can we limit them to coming into our property, but we only let them go in as far as the front lobby? Or can we put packages outside for them to pick up and have some, if you've got security concerns with leaving packages out, is there a way to work around that? But if at all possible, we can keep people coming onto our property and potentially infecting that's going to be a good practice. Identify those persons that are essential. Obviously, if we're having issues with our heating, ventilating, and air conditioning, and a service rep has to come on property, that's something that we want done. But again, screen them as they come in, take their temperature, have them fill out, if you're having a signed form that reminds them of the things that might exclude them from coming onto your business. And again, anybody that comes in at a minimum, we want to make sure that they're using hand sanitizer to make sure their hands are clean as they come into our building. And the last thing is consider excluding visits from the family members of employees, their spouses, and their children, just to cut down on traffic inside of our building. So we'll take a quick question break here. Lisa, do you have any questions on your end?
I do have a couple.
Okay.
The first one is, does this checklist need to be done for every location, or can you do one overall for the entire company?
I guess that would depend on, when we say other locations, Lisa, are we talking about, a satellite office that has one or two people, or are we talking about, 4 or 5 locations that all have 20? I would say if it's like a satellite type of thing where it's only got a couple of employees, we could probably do a checklist for the entire company and then make sure that all of those locations are kind of addressed in that single checklist. But if we've got actual multiple locations where, we have equal numbers of people in multiple locations, probably need a checklist for each location.
And then the second question is, where can a person get these checklists or other documents?
So those are available from download. If you go to the North Dakota Safety Council website, ndsc.org, go under the COVID-19 area of our website, and there is a list of COVID-19 resources. There's a link to that document on the North Dakota Department of Health's website. They can also go to ndresponse.gov, and that's going to get you into the COVID-19 areas associated with the North Dakota Department of Health, and they'll find that form there as well.
Perfect.
Got a couple questions here. Kay Bach, and can you have the OSHA rep confirm that the employer is responsible to pay for the medical evaluation of an employee? Could the employer direct the employee that they are not allowed to wear one voluntarily? So again, I'm going to let the OSHA folks speak to that. Do you think it is important to document the temp if you send them home? I would think recording keeping is important if you plan to send them home because of it. Again, keep in mind that if you document that temperature, we have now created a document that has some privacy concerns. So you're going to want to address that with your HR professionals, or maybe even include a little bit from your legal staff as far as how you want to do that. But if you, again, employee by employee, that might be different.
Yeah, if the bottom line is if we record that, it does become a medical record. So then, just like when we go into a hospital or a clinic, that employee is going to have to give you, the employer, written permission as to how you use that record, and it opens up all sorts of other privacy issues. So best practice is not create a health record if you don't have to. I think you could simply document that they had a temperature above 100.4, and that should be plenty. But I would also follow John's advice to make sure you consult with an HR legal professional just to make sure that we're doing that documentation properly.
It might be just something as simple as employee displayed symptoms consistent with COVID-19 that excluded them from coming onto the property.
Yeah.
Something along those lines that
Absolutely.
is very vague, yet relatively specific to what you're trying to accomplish. Okay. Lisa, any more questions on your end?
Nope, nothing from here.
Okay, thanks. We're going to march on. So, Don talked about some of the engineering components of mitigating the coronavirus, the COVID-19 virus, and barriers are one of those means by which we can engineer, or at least attempt to engineer, this virus out of our business and protect our staff. Keep in mind, in a pandemic setting, right, you can do everything perfect to try to mitigate this virus, and you may not be successful. That's why the OSHA folks are looking for a good faith effort to try to protect your staff. One of those things that we can do is by putting up barriers. If we have employees that are in cubicles or in a shared work area, if we can make those walls a little bit taller to prevent and keep the water droplet portion of this spreading to a minimum. We're seeing that again in a lot of our retail stores. Now as you go out, that plexiglass to create some separation between the customers and your service staff is another good practice. Where barriers are not an option, look at extra distancing, whether that's just putting a table or some barrier tape around that service area for your employee to keep your customers back at that 6-foot distance. PPE for your employees, you can look at electronic options such as a call box. We've seen in certain businesses here in the Bismarck area where they actually have their front door locked and they have their phone number posted on the door, and they'll call that phone number, and that way you can communicate with that person, make that determination if you're going to let them come onto your property. If they need to, then we're going to go through our admitting process for that individual person. So again, it's all about protecting our property and protecting our assets. So kitchens and break rooms. This has been kind of the area where we've had a lot of discussions on, and it's those common things that happen in the workplace, those common shared areas that propose an increased risk to our employees. So increasing access to tissues, right? Obviously, we come into the spring, we have a lot of pollen, we have people's allergies that start to kick up. They may not necessarily be infected with the COVID-19, but we want to make sure that they have access to tissues if they need to sneeze. And then again, enough trash cans to ensure that they can easily throw that away. And then following that, have access to hand sanitizer. So having those items in your building in strategic locations so they're available to staff is vitally important. Reusable utensils, commonly found in the workplace as we go into break room, whether that's plastic forks and metallic forks. If we've got reusable stuff, they don't always get cleaned to the standard that they might get cleaned if they're in a restaurant. If you do, fantastic, but consider removing the reusable utensils and flatware. If you've got plates in your break room, maybe consider getting rid of those for the time being and putting in using paper plates and plastic silverware. Removing chairs and tables as needed to enforce social distancing. If this is your break area, if this is a conference room, a classroom setting on your property, the best way to ensure that people maintain their social distancing is to remove those chairs to keep people spaced out. And this is what you're seeing in the restaurants as they reopen. They're limiting the use of chairs. Men's bathrooms, the urinals, they can close off every other urinal so that we don't have people, again, getting into close proximity with each other and violating those social distance guidelines. Other things to consider in your break rooms is the common areas, the microwave, the coffee pot, the ice machine, the vending machines. All of these commonly touched things are going to need to have regular disinfecting if you're going to continue to keep them open. We've heard of companies that they're just closing their break room down altogether and instructing staff to bring in their own soda and their own snacks and things like that from home, just to completely remove that component from the equation. So a lot of different options out there. You got to do what's right for you. Common question, how often do I need to disinfect these areas if I'm not going to close them down? Again, that's going to depend on how many staff you have in your building. If you have, say, 10 staff members, there may not be that need to disinfect more than twice a day. If it's even smaller than that, maybe just disinfecting at the end of the day, ensure that staff are doing good hand washing and so on and so forth might be adequate. But if you've got a lot of staff members, multiple disinfectings throughout the day, particularly at the end of shift changes. If we've got people using the time clock, we might want to make sure that as soon as we have a shift change, that we're getting that area disinfected where we had a lot of people come through. Encouraging employees to take their breaks outdoors. Again, not only because fresh air is good and there's low risk associated with it, but also keep in mind, things are a little bit stressful right now. People worried about losing their jobs. There's financial stress. There's just the overall stress from being at risk from this virus. Maybe they've got family members that they're worried about. And that really getting outside, getting in the sunshine, or in the clouds and the rain, if you're looking at today, helps to bring that stress down, brings out a good sense of well-being. So encourage that. Employee travel. Banning non-essential employee travel. This is one of the things that we saw very early on in the COVID-19 mitigations that were put out by the North Dakota Department of Health, and making sure that, do we really need to send that employee to Montana, South Dakota, or Minnesota? What are the risks associated with that? Because it's really about, when we look at an asset, not only our building, but our most important asset is going to be our staff members, and we need to keep them well. If you work in a manufacturing facility where you are highly dependent on your staff being able to come and perform their work, as we saw with, say, L&M wind energy up in the Grand Forks area that if this virus gets into your business can quickly shut you down and bring your work capacity down to non-existent if you're not careful. So again, limiting that travel is going to be a difficult thing. No travel to areas with substantial risk until the last phase of the state plan is reached. The North Dakota Department of Health has implemented this phase or step-by-step approach to how we're going to do this smart restart, and keeping that travel to a minimum until we get to that last phase is what's being advised. Encourage employees not to travel on personal time to high exposure areas. Again, we can ask, but we don't have the power to say absolutely not. You can, that gets into constitutional things. But again, working with your employees to be honest with you, not only about are they having symptoms, as was brought up before, but are you going to be traveling, and are they able to self-isolate for 14 days if need be? Are they able to work from home when they return from those trips? So let them know they may be asked to quarantine when they get back. Small spaces. One of the other administrative controls that we can do in our building is limit the number of people in confined spaces, such as bathrooms and elevators. We talked about, every other men's urinal to ensure that there's not that social distancing. We also have the elevators. Depending on the size of your elevator, are people able to keep that 6 foot social distancing recommendation in place? Or do you need to put a sign on your elevator that says single use only or something along those lines? Vehicles. If you have employees that are using company vehicles, if it's a regular 4-door vehicle or a hatchback, smaller vehicle, try to limit the occupancy to one person in that vehicle. If you've got 4-door cars, crew cab pickups, and they're able to maintain a approximate 6 foot distance in that vehicle, then you can put 2 in there. Again, good idea to put masks on those people, again, as they're riding in that vehicle, as they're sharing air. Make sure that they're getting good air circulation in the vehicle. That's a good practice as well. Keep in mind, shared vehicle, when they bring those vehicles back at the end of the day, great idea to have them disinfect any shared spaces, wiping down all the areas inside that vehicle that may have been touched by the operator. Best practices to use signage to remind employees and others of new spacing requirements. Again, signage around the building, just as that general reminder. It's so easy to fall back into our old routines as staff persons begin to come back to work. We're excited to be getting back to kind of a normal operations. Staff are getting to interact with each other. It's really easy to fall back into those old habits, and we risk a potential exposure. Mental health of our employees. Some things to keep in mind. Daycare and homeschool support. There is an astronomical amount of stress and weight on our parents that are home with no daycare, and they're also being asked to homeschool their students. Some of them have good support from their teachers, some don't. Some teachers are, here's a packet of stuff for the week. Other teachers are providing online activities with their students and helping the parents along with that. So keep that in mind, that these are stressful times to those people as well. Financial counseling services. If we've got staff whose hours have been cut or their spouse's hours have been cut, obviously that puts some stress on the family, and having resources available for them is a good practice as well. Substance abuse resources. The last I heard, alcohol sales are up roughly 25% in the state of North Dakota as people fall back on that as a coping mechanism for the stress that's involved. We need to keep a sharp eye on that and making sure that staff have resources available to them. Team building and mental health support initiatives to improve employee morale. One of the things that we've done here at the Safety Council is just kind of a day or every other day check-in where everybody gets onto Zoom and we just have a talk about what you've been doing, what's your family been doing, and encouraging some social interaction as people that are working from home. There's some stresses that go along with that. They feel like they're maybe a little bit isolated from the workplace. So it's good to bring everybody together to have a little morale boosting session. Make sure your supervisors have the proper training to interact with employees that are going to be under a little bit more stress than normal when they come back, and seek out resources for that. Have an anonymous reporting system. If you've got employees that are showing signs of severe depression and your other employees want to kind of maybe bring that to your attention, if you can have an anonymous reporting system that facilitates that communication, so somebody from your HR, somebody from your leadership team can reach out to those employees just to make sure that they're doing okay and maybe they don't need a little bit extra resources to help them get through these difficult times. Regular management employee communications. Make sure we're touching base with these employees. If we've had staff that are furloughed, staff that are laid off, making sure that, we're reaching out to them on occasion to let them know what's going on in the workplace. Is my job still secure, or do I need to start looking for other work? And just making sure that they're in the loop on happenings, and as the payroll protection plan funds are out there, how does that impact your employees, and just make sure that we're doing a good job of keeping them in the loop. Other distancing considerations. Traffic patterns through your properties. Are you going to have a single entrance point and a single exit point from your building to minimize visitors and staff from passing by each other? Are we going to put markings on the floor like we're seeing at the supermarkets to ensure that people are maintaining social distancing? As much as I dislike IKEA has had what I call their cattle chute mentality in place for many, many years, right? Once you get on the pathway, you're on the pathway and everybody moves in the general direction. If we can make sure that we're ensuring that social distancing as they go through that process, that's fantastic. But again, simple ways to mitigate within your company. Traffic arrows, minimizing passing, the things that we're seeing at Walmart and other stores where they're limiting the number of occupancy into their store, and people that are waiting outside the building, we want to make sure that they're maintaining their safe distancing as well. Spacing with tables, spacing chairs out. That's one of the things that we're doing here at the Safety Council within our classrooms, besides disinfecting a couple times a day, is making sure that our tables are spread out. We've got one student at each table to ensure that we're maintaining our social distancing. So that's a good thing to practice as well. We'll take another quick question break. Lisa, what questions do you have there?
I got nothing.
You got nothing. All right. I think we are good on this side as well, and we'll just keep marching on. Again, we're going to have our OSHA staff here and our WSI type of folks hopefully show up in probably the next 20 minutes or so. And if you have specific questions for these leaders in these agencies, it's a great time to do so. Some guidelines from the North Dakota Smart Restart. Again, 50% capacity for certain businesses. This is going to be our bars and our restaurants. If you got out this weekend, you'll notice every other table, they've done a really good job, not only cleaning, but making sure that their guests are spaced out. The staff might be wearing masks, wearing gloves to protect their visitors. There's no longer standing at the bar areas. Everybody's got to have a seat to be able to sit down and have a drink or to eat some food. Dance floors where people are in close proximity are not being allowed. Hair salons, people need to plan for PPE for not only for their visitors and their customers, but also for their staff. They're recommending gowns for the hair salons and requesting your customers and your staff to wear masks as they come in to get their hair done. So another resource that is out there is what's called the Care19 app. And this is a tracing app established by the North Dakota Health Department that allows them to track your location if you become infected, and they need to trace where you have been, say in your hometown area. If you're in the Fargo area, you get diagnosed, they can use this app to go back and identify where you've been at and to determine if you've put other people at risk and if they need to do that tracing throughout a business or come in contact with other persons that may unknowingly be infected. So a lot of good resources on the ndresponse.gov website. Obviously with this virus, as we learn more about it and we are asked really good questions and there's different mitigation things that come out, this information that's being put out is constantly changing. And it's good to frequent the visiting there and make sure that you're getting the latest information and resources available for the COVID-19 pandemic. A couple things from the Human Resource Department. Anticipate that your employees are going to ask questions. Questions about layoffs, furloughs. Do I need to take PTO? Do I need to take time without pay? Make sure that you have those answers readily available for them. Make sure that you have a work from home policy in place. So everybody, the employee and the employer, are on the same page with what those expectations are if they're working from home. Making sure that your IT staff, or if you have staff that do that type of work, everybody has the ability to work from home, making sure that we can even do that in our workplace. Risk reduction for high-risk termination procedures. If you're going to be laying off staff, that's actually one of Don's areas of expertise, is reducing that risk associated with termination procedures. If you anticipate that you might have some violence involved, feel free to reach out to Don with those questions. Again, your employer should be prepared to consult any legal people that guide your business, as well as if you've got certain circumstances, special circumstances that you anticipate some difficulty in maneuvering, reach out to HR professional guidance people and legal counsel as you see fit. Things to consider in the first days of reopening. And I just want to back up here real quick, back to this slide. Remember to stay ahead of social media as we want to make sure that we have answers to our employees, that if you don't have those answers, your staff are going to talk, they're going to be on social media, and we're all familiar with how things are easily spun up in those environments. So take some time, get with your leadership team, and have those answers available to your staff. Again, tasks to consider in the first days of reopening. General health screening should be applied to critical infrastructure employees such as power plants, coal mines, utilities, and healthcares. Likewise, our own businesses. Okay, that's critical infrastructure to us, is protecting our buildings, making sure that we're doing those generic health screenings for people that enter our building. The Department of Health and your occupational medical providers can give you additional guidance on what type of questions that you should ask your visitors and employees before they enter our buildings. If workers are on shifts, we want to make sure that we're minimizing that overlap to avoid exposure. We may have to look at staggering how employees come in. If our shift change is at 3 o'clock in the afternoon, we might want some employees to come in at 2:30. Again, other employees to come in at 2:45. Others come in a little bit closer to 3 to minimize that backing up of staff at time clocks and break rooms and locker rooms and so on and so forth. Returning furlough to remote employees to work in batches, right? Our goal is to protect our staff and our infrastructure. If we've got 10 staff members that have been working from home, we don't want to return them all to the workplace at the same time, because that elevates our risk of exposure. If one of them comes in sick, now everybody's sick. But if we want to bring in, say 2 or 3 staff members at a time, introduce them to the workplace after 2 weeks or 14 days, nobody's sick, we'll bring in a few more. That way we're not running that risk of, we're minimizing that risk of getting everybody in our workplace exposed to that virus. Daily cleaning practices. So hand washing 101, as much as we've been beat to death with having to wash our hands over the last month and a half or 2 months, I can't underscore this enough that the best way that we can minimize ourselves getting sick and our staff getting sick is to making sure that they're washing their hands on a regular basis. Lots of water, lots of soap. It doesn't matter if it's antibacterial soap or if it's regular liquid soap or a bar soap that you're using. They all do a fantastic job of killing the COVID-19 virus. We just want to make sure that that soap is in contact with all areas of our hands for about 20 seconds. We want to focus on the backs of the hands, the backs of our thumbs, the fingertips, the areas that are easily forgotten when we wash our hands. Just make sure that we cover all areas of our hands with a good amount of soap, and it's on there for 20 seconds. So disposable rags are going to be your best practice, using paper towels where people can dry their hands and throw them away. If you have to use reusable towels, and I'll use the examples of a hotel with a swimming pool where you might have staff, or not staff, your guests sharing towels. If it's a professional cleaning service where they're using towels, make sure that we're washing them in an increased manner, using maybe a little bit more soap, some good hot water to make sure that we don't get a buildup of those germs on our reusable linens. Cleaning and disinfecting. What is the difference? So when we clean something, we're focusing on a lot of times removing organic matter, whether that's dirt or grease. And we typically use soap to break down those organic materials. That soap that we're using may not kill the germs, kill all of the germs. It may kill some of them, but it may just lower their numbers or even maybe move those germs around on that surface. When we talk about disinfecting, this is using specific chemicals to kill the germs and bacteria, viruses that are on surfaces. Keep in mind that not all disinfecting solutions are good cleaners. So we may need to clean something to remove the organic material and follow that with a good disinfecting of that surface. If you are using contracted cleaning services, here are some good questions for you to ask them. Are they screening their staff for wellness on a daily basis to ensure that they're not coming into your building and getting them sick? And if they're not, we may have to come up with some type of a screening mechanism to make sure that as they come in the evening, if you're leaving for the day, we may need to have somebody stay late to make sure that they're screened from a health perspective to come onto our property. What areas of equipment and furniture are they disinfecting? How often are they disinfecting? Are they disinfecting every night that they come in? If they come in 3 nights a week, but they're only disinfecting on 1 or 2 nights, you may want to have them increase that disinfecting or implement some disinfecting procedures within your company on your own. What chemicals and products are they using? Are they using a product that's in the non-consumer spectrum? So to clarify that, if you are going to Walmart or you're going to Menards or Lowe's or wherever to purchase your cleaning materials, those cleaners and disinfectants are going to fall within the consumer spectrum. If you went down to a janitorial supply company and picked up some commercial cleaners, such as a quaternary ammonia cleaner that they would use in the hospital, you've kind of now entered that non-consumer spectrum, and that brings with it some other things that we need to consider from an OSHA perspective. Do we need to have that SDS information available to our staff? Absolutely, if it's in that non-consumer spectrum. We also need to make sure that our staff are trained on that chemical, they're aware of the risks, we have the appropriate PPE, and we also need to make sure that our bottles are labeled properly. If you've done this, if you've gone down to your local supply place because you couldn't get cleaning supplies at your normal location and you need that SDS, you can usually go to the manufacturer's website, download that safety data sheet, and a lot of times they're going to have printable bottle labels that you can take print off and then secure to the bottles so that all of that information is there and it's readable, rather than just taking a Sharpie and scribbling some words on a bottle. Other means that we can lower the risk for employee exposures: limit the handling of cash or credit cards using machines, and having them wear gloves. We're going to talk about gloves a little bit more in detail. But if we can minimize the exchange of credit cards and cash, that's a good practice as well. Obviously, debit cards and entering PIN numbers bring their own component, but we need to make sure that we're disinfecting those keypads throughout the day as well. The CDC recommends hand washing when at all possible. If we can have our staff wash their hands, it does a better job as compared to hand sanitizer. Now, if hand sanitizer is all your employees have, by all means use that, but understand that hand washing is going to do a better job of removing those virus and bacteria from our hands. If you're using gloves, beware of cross-contamination. We see a lot of people wearing gloves out in public and in the workplace. Remember that gloves do not have magical powers. Gloves need to be changed on a regular basis. Just because you're wearing gloves, it does protect the wearer. But again, if you wipe your face, you scratch your eye, you wipe your nose wearing those gloves, you can likely contaminate yourself as well. But as you're wearing those gloves, you're going through your workplace and you're touching different areas, you're still tracking that virus or bacteria wherever you touch. So if you've got staff wearing gloves, working at a register or an isolated area, when they take their break, we need to make sure that they're taking those gloves off properly, disposing of them properly, and then sanitizing or washing their hands before they go onto another area to prevent that cross-contamination. If you have staff that have open sores, nicks, and cuts on their skin, gloves are recommended, because each of those nicks or scratches that's present on their hands is a portal for that virus to enter their body. So keep that in mind. Key surfaces for disinfecting. As you do your assessment tool from the North Dakota Department of Health, here's a few areas that you want to pay particular attention to: doorknobs, handles, and push pads on doors. One of the things that we've done in here to mitigate this is we've got door stops, and all of the common doors that we go in and out of throughout the day, other than the bathroom doors, have been propped open, so they don't even need to touch that doorknob or handle to get into to that area. Obviously, there's security concerns, and some of those doors have had to remain secured, but it minimizes that need to disinfect. Bathrooms are, again, a common place where people are touching surfaces, making sure that you have plenty of soap, you have plenty of towels available. Breakrooms and kitchens, we talked about these: the microwave, the coffee pot, the sink, the handle on the refrigerator door, and so on and so forth, making sure that those are getting disinfected. Desks and tables, making sure your staff clean up their desk at the end of the day or at the start of the day or whatever that ends up looking like. Tools and equipment, shared equipment, mechanic shops. If your mechanics aren't using their own equipment, repair industries, make sure that we're looking at those shared tools and equipment to get those disinfected. Again, countertops are a common thing in the workplace. Those need to be disinfected. Shared keyboards, keypads, and electronic devices. And again, stairwells. While we encourage our staff to take the stairs, not the elevator, everybody's touching that handrail as they go down the stairs. Make sure that gets wiped off as well. Lisa, do you have any questions there? We're going to take a break here in the next couple minutes.
Nope, nothing on my end.
All right, we've got one question here from Angie. You may have already said this, but will this PowerPoint be available after the webinar? Yes, so we're going to, in the next week or so, the presentation will be present on our website. You'll be able to watch the video from our website under the COVID-19 resources. Likewise, the email address that you registered for this course, you will get a PDF version of the PowerPoint presentation to use as a reference for your company. So give our IT staff and our marketing folks, 3, 4, 5 days to get that stuff out to you. And with that, we're going to take a 5-minute break here. When we come back, some of our subject matter experts will be present to answer any questions that you guys have, again, using that chat feature. So if you've got those questions and you want to throw those to them, you can submit those at this time. And we will see you back here in 5 minutes.